Hi, I'm Ratiba and I'm a registered clinical counselor. I was a respiratory therapist for 15 years and working in a hospital and treating physical symptoms. I really quickly realized that there was a big gap between mental health and physical health. It all got my curiosity going of these two things have to be connected somehow. That's what led to me going on this journey and path towards therapy to really find that connection and that missing piece. I would say my therapeutic approach is not a one size fits all. Every client is unique and they have their own needs. I do focus on creating that safe, comfortable space where a client feels that they can express themselves fully. I have an integrative and client centered approach where I draw on different modalities depending on what the client needs in those moments. I approach clients with a culturally attuned and trauma informed lens. I look at a person's culture, background, and upbringing as a way to inform me about them. And when I say trauma informed, that means sometimes for a person, past experiences can really continue to show up in their day to day life. And so I take those two things into account when I'm listening to a client's story. Growing up, always feeling different, whether it was the color of my skin or coming from a really strong immigrant community, I knew from a very young age that I felt that I didn't belong. And so to work through that when I was really young, I understand when clients come to me and say, I don't know where I fit in and I'm not feeling so good about myself. That's really something that I resonate with. And furthermore, through my lived experience becoming a mother, I think that was a transformative journey for me where I didn't meet the status quo of this is going to be wonderful and this is going to be easy. I felt the difficulty. And so it really helped me empathize with other women who were struggling with that transition. And overall, I think all of these experiences has really taught me to tune in to my own internal dialogue while also seeking help. I also sat on the chair and talked to somebody, and I found that it was very beneficial and transformative for me. I think that the client therapist relationship is the foundation of meaningful therapy. What that looks like is offering a warm, safe, inviting space with 100% respect for clients, coming in with a non judgmental approach, open and accepting. And only when those conditions are met will a client feel that courage and bravery to be vulnerable and really reach those difficult emotions. If you're thinking about seeking therapy and you're unsure, there is a misconception that seeking therapy equates to weakness, when really I think it's a courageous and brave act to do for yourself as a person.